Okay, today I'm going to teach you about COPD.
Alright.
Here is a handout that I have for you. You can follow along with me if you would like. COPD is chronic obstructive pulmonary disease, and it's a term used to describe chronic lung diseases including emphysema and chronic bronchitis. This disease is characterized by breathlessness. COPD is the name given to a group of diseases that limit the flow of air in and out of your lungs. This makes it harder to breathe. With COPD, you are also most likely to get lung infections. COPD includes chronic bronchitis and emphysema. COPD is most often caused by a heavy long-term cigarette smoking. Chronic means that this disease lasts a long time and is always present. While the symptoms may take years to develop and severity may differ at times, there is still much you can do to slow the progress of the disease. Obstructive means it's the ability to move air in and out of your lungs is blocked or obstructed. This is caused by swelling and extra mucus in the tubes of the lungs airways, which carry air in and out. The pulmonary means the disease is in your lungs. Disease, your lungs have some damage, but even though a cure has not been found yet, your symptoms can be treated. What causes COPD? The cause of COPD is usually long-term exposure to irritants that damage your lungs and airways. In the United States, cigarette smoking is the main cause. Pipe, cigar, and other types of tobacco smoke can also cause COPD, especially if you inhale them. Exposure to other inhaled irritants can be contributed to COPD. These include secondhand smoke, air pollution, and chemical fumes or dust from the environment or workplace. Symptoms of COPD, you can have increased shortness of breath, frequent coughing and wheezing, and tightness in your chest. Complications that can come from COPD, you can get respiratory infections. People with COPD are likely to catch colds, the flu, and pneumonia. You can have complications of heart problems. You can have lung cancer. You can get high blood pressure and lung arteries. You could also get depression. Depression would be because it can keep the COPD could keep you from doing the activities that you enjoy. Diagnosis of COPD is pulmonary function tests. This includes the spirometry of the lung volume test, ventilation perfusion scanning, serum alpha, arterial blood gases, pulse oximetry, exhaled carbon dioxide, a CBC with white blood cell differential, and a chest x-ray. Some treatments: you can quit smoking, you can take antibiotics, you can take bronchodilators, you can take corticosteroids, oxygen, surgery, and lung therapies. If you smoke, quit. It's the best thing you can do for COPD and your overall health. Protect yourself from infection. Wash your hands. Do your best to keep your hands away from your face. Most germs are spread from your hands to your mouth. Get a flu shot every year.
Done?
To stay healthy, get enough sleep, exercise regularly, and eat a balanced diet. Get about 8 hours of sleep every night. Try to exercise for at least 30 minutes a day. Take your medications exactly as directed. Don't skip doses.
Yeah, Dad.
Another way to help manage your COPD is to manage your stress. When to call your doctor. Call your doctor right away if you have any of the following. If you have shortness of breath, wheezing, coughing, if you have more mucus, if it's yellow, green, bloody, or smells, if you have fevers or chills, if you have tightness in your chest that does not go away with the rest or medicine, an irregular heartbeat or feeling that your heart is beating very fast, and swollen ankles. Do you have any questions about COPD?
So, can you, if you get it, can you make it go away if you, do a bunch of healthy things?
There is no cure for COPD, but we can manage your symptoms.
Does it ever get better?
No.
Well,
So best you stay where you're at.
Yes.
well,
Okay. Well, that's sad.
well.
Do you have any other questions?
Yeah. What is serum alpha 1 antitrypsin?
It's a genetic condition, and it can play a role causing COPD.
Oh, so when they look for that, so here what it means is that you're looking at like your
Genetics.
okay.
Okay. Thank you, Jackson.